time and we'll get started. Good afternoon again. My name is Midra Surratt. I'm the Executive Director of Parent Information Center of Delaware. And on behalf of PIC, we are presenting today's presentation, which is Navigating Healthcare Transitions with Your Teen / Young Adult. We are thrilled to have Lauren Gillespie with us today. Lauren is a friend and partner of PIC and always has a wealth of knowledge and information. This presentation is presented on behalf of the Family Shade, which is the Support Healthcare Alliance Delaware project. This is a project that provides support and resources to parents of children with disabilities, special healthcare needs, and medical complexities. So we will move into the presentation. We will have time for questions at the end of the presentation. However, feel free to utilize the chat. If you have a question that pops in your mind, utilize the chat. We will make sure that all questions are addressed in the presentation. And then lastly, this presentation is being recorded. And so you will have the opportunity to listen to the recording afterwards. And the resources shared today will be sent to everyone after the webinar as well. So I would like to now present Lauren. Lauren, thank you so much for joining us.
Oh, you're welcome. It's so nice to see some familiar and friendly faces. Hello, everybody. And Midra, thank you for handling my slides, because I always get stressed out about the tech stuff. So this takes that off my plate. I appreciate that. So we can go ahead. Our objectives for today, I have a lot of information to share. And so what we're going to do today, I'm going to talk a little bit about the transition plan program. We're going to define and discuss healthcare transition. We're going to talk about what happens when you or your young adult turns 18 from a legal standpoint and how to prepare. And then we're going to talk about some resources and some things to keep in mind to help your young adult become a self-advocate and a self-manager of their own health, and also just to deliver the message that support is okay and how to help with that. And then we're going to take your questions. Next slide, thanks. So just a little bit about me. I'm Lauren Gillespie. I am the transition coordinator for Nemours. So I work in pediatrics, but my background is from the adult world. I've spent most of my career as a social worker and a medical social worker on the adult side of things, working with young adults and adults with special healthcare needs, and working on the adult side of things and the adult side of healthcare, the adult side of Medicaid, and just working, with adults generally. So working with pediatrics has been a relatively new adventure for me. It's been with the last 5 years. So when I'm speaking with you, I'm really speaking with you based on my knowledge of working on the adult side of things and bringing that experience to pediatrics. So that's kind of where I'm coming from. So let me just tell you a little bit about our program at Nemours Children's Health. We have 90-minute yearly consultations for young adults starting their transition out of Nemours, out of pediatrics, and into adulthood. Sometimes people are interested in starting to talk about this as young as 10 or 11, but usually we start meeting with patients and families around 16 or 17. That's most typical. We talk to families yearly, but more if needed. We provide support anytime it's needed. So families usually they call me as a social worker. Anytime they're running into issues, or if they have questions, if there's something they want to review. Dr. Amy Renwick and I see patients together once they hit 18. Now, this is newer. We have changed our model over the last couple of years. So we see patients together in the clinic, in our office, once they hit 18, and we do telehealth. Something new for the under 18-year-old crowd is social work phone consultations with me. So if your young adult is, say, 16 or 17, we start with a phone consultation with me where we talk not so much about the medical transition, although we do touch on it, but more about the psychosocial things, the things that people are worrying about, like decision-making, some of the things we're going to talk about today. Next slide, please. All right, so these are a lot of words, but what is healthcare transition? And I can't even see all this because I've got I got your beautiful faces right here, but healthcare transition, or HCT, and this is from the Got Transition website. Formally, to put it out there, it's the process of moving from a child or family-centered model of healthcare to the adult or patient-centered model of healthcare. with or without transferring to a new clinician. So if you have a family medicine doctor, you might not change your doctor, but it involves planning, transfer, and integration into adult-centered healthcare, which is different than pediatric. The goals of healthcare transition are to improve the ability of youth and young adults with and without special healthcare needs to manage their own healthcare and to effectively use health services, and to ensure an organized process in pediatric and adult healthcare practices to facilitate transition preparation, transfer of care, and integration into adult-centered healthcare. And that's straight from Got Transition, which is a wonderful resource from 2024. Next, please. Okay, that was a lot of words, right? So can we just take a minute? Now you've got a social worker here. I'm also a licensed therapist. Can we please just take a second to close our eyes if we wish? Can we take a breath in through our nose and out through our mouth? And then again, in through our nose. Out through our mouths. It's great if that exhale can be a little bit longer than our inhale. It's a bit more relaxing. Let's just set our intention for this time together. Think back to your own transition to adulthood. And just think about like some of those feelings, some of those emotions. What was that transition like for you? You can think back. And maybe as parents, we're also having some feelings and some worries, some feelings of uncertainties as we think about our own young adults going into the adult world and leaving pediatrics. I just want to normalize that is very normal and expected. Change is hard. And there's a lot of feelings of loss around leaving the pediatric team, especially when someone's had complexities in their care and has really developed a relationship with their pediatric team, has been with them for a long time. And that's very expected, to have tears as you consider transitioning out of pediatrics, to be nervous, to have fears and just uncertainty, and just not be really ready for what's coming ahead. And that's just all very normal and expected. And I just want to normalize that for you. And if you can normalize that for your young adults too, you know, putting names to feelings can be really healing for people and can do a lot for sort of just, maybe you've heard the phrase name it to tame it. That can really help young adults and families just feel a lot better as everyone's dealing with these hard changes. So our clinics oftentimes include tears, and appointments on the adult side sometimes include tears, and this is also normal. So I just wanted to mention that. Next slide, please. So we got to get into the nitty-gritty now. When we're thinking about switching from pediatric to adult care, we got to think about who's going to steer the ship. And so that involves thinking about who is going to lead your young adults medical team when they transition to the adult care. And this might be a little bit different than you're used to from pediatric care. So in pediatric care, a lot of times your specialists are kind of steering the ship. In adult care, a lot of times it's your primary care doctor that sort of takes over that role, steering the ship, being the quarterback, however you want to say it. So it's really important to figure out who your primary care doctor is going to be on the adult side, and have somebody who's really going to be someone that you trust, that you feel comfortable with. And then figuring out, who are those adult specialists going to be, who's going to provide your dental care, your eye care, and all these sorts of things. So that's something that we cover in our clinic, is figuring out who is the adult medical team going to be. Next slide. So one of our local resources is the Center for Special Healthcare Needs. Now, this is one of the places that I have worked in the past, and very early on in the Center for Special Healthcare Needs, before it had this name, I worked here with one of the founding doctors. We used to have a tiny little space in the pediatry clinic at Wilmington Hospital. We had a tiny little area with a big picture of a foot. I don't think I'll ever forget the parts of a foot because of this, where we would just see very select patients who had very complex medical needs because they were finding that they were not able to find primary care doctors once they transitioned out of Nemours. So this clinic was founded based on these young adults transitioning out of Nemours and not being able to find adult doctors. And we were that clinic for them. Now, over the years, this has transitioned into a clinic that sees hundreds of young adults with special healthcare needs of all different types, and including complex social situations. So they see a lot of young adults transitioning out of foster care, people with complex social situations. And you don't have to see them for primary care to use their specialty clinics. So I encourage you to look at their website and see if they might be a primary care clinic that would serve you well, or if they might have a specialty clinic that would serve you well. There are plenty of other primary care doctors, locally that might also serve you well, but they might also fit into your picture as well. Their docs are Family Med and Med Peds, and Med Peds are really great doctors for people who have complex medical needs that originate in childhood, because Med Ped doctors are duly certified in pediatrics and internal medicine, adult medicine. So they understand childhood onset conditions and they understand adult medicine. So they're really a perfect fit. And Med Ped doctors can be hard to find, but they definitely are within this practice. So Med Ped doctors and family medicine doctors really understand childhood onset conditions. So you can always look for them for adult care and usually have a pretty good outcome. This practice happens to have, I'm sorry. This practice happens to have longer appointment times. They have social work, which a lot of adult practices do not have. And they have case management. They just have a lot of supports. So I'm just putting my plug in. I don't work for them anymore, but I do have a lot of good feelings toward this practice, and I do work with them very closely. Okay, we can keep going. Other states also have some practices that have similar sort of orientations, like the Center for Special Healthcare Needs. So if you have friends or family in other states nearby, Pennsylvania has the FAB Center for Complex Care, which is at the Navy Yard. New Jersey has RISN, which was founded by the doctor who founded the Center for Special Healthcare Needs with me in pediatry all those years ago, Dr. Jennifer LeCompte. And Pennsylvania also has a really neat practice up in Radnor that's specifically for adolescents aged 12 to 29. And that's a really great practice too. So just to give you a couple of resources if you know people out of state, or if you have any intention of moving out of state. So go ahead. Thank you. So people often wonder, like, how does adult care differ from pediatrics? And sometimes people want to just stay with their pediatrician forever if possible. And sometimes pediatricians want to do that too. Now with Nemours, we have age limits that are very specific, so people cannot do that. But sometimes you might have a private pediatrician who is like, oh, just stay forever until I retire, or like you can just stay forever. But adults aren't just big children. Adults have different needs than children do. So here's a resource you can kind of look at that explains how adult care does differ from pediatric care. And you can look at this with your young adult to explain some things. But here's like a little overview of just some general things about what differs once you transition to adult care. So with pediatrics, your parents, it's a given, your parents are going to be with you in the visit. Now, as teenagers get older, sometimes they do shuttle the parents out for part of the visit, and that's pretty typical. But with adult care, it's kind of assumed that your parent isn't going to be there unless you request to have your parent there. With adult care, you're sort of the one that the doctors talk to automatically. You're in the hot seat, as we like to explain to young adults. With adult care, you're sort of expected to be making your appointments. If your parent calls and asks for information, you're not, as the parent, once your young adult is over 18, you're not going to be automatically given information. And that really does come as a shock to a lot of parents. So these are things that, we address in clinic. Another thing with adult Medicaid that really comes as a surprise to parents and also pediatric providers, because they haven't really encountered this in pediatrics, is that as a general rule, adult Medicaid doesn't pay for out-of-state providers, with some exceptions. In pediatrics, Medicaid doesn't really care. They'll pay for out-of-state stuff. But for adult Medicaid, they really don't want to pay for out-of-state providers. Yes, Christina, yes, except for the guardianship. That is a caveat. So adult Medicaid, so a lot of times pediatricians or, pediatric providers will recommend adult providers out of state, not realizing that Medicaid typically isn't going to pay for out of state providers if that specialty exists in state. So sometimes people get stuck not having adult providers because they don't have a state recommendation. So that is something that does differ in the adult. So one of the things that we really focus on in our clinic is independence and taking ownership of health to the extent that the young adult can. So even if it's just a little bit, we try to help families focus on what can your young adult take over, or what can they help with, what can they develop in terms of taking ownership of their health. So sometimes, in clinic, we really focus on the young adult and seeing what do they know, what could they develop. So a lot of times, and if you've been to our clinic, you'll know this, like Dr. Renwick will ask the young adult, oh, do you have any allergies? And the parent will jump in and be like, oh, she's allergic to, and then we'll ask the parent could you just take a step back and like, can we see what, Johnny can answer? And it's hard because as parents, we're used to filling in the gaps. We're used to knowing all the answers. So one of the things at our appointments is we kind of mimic an adult appointment where a provider is going to talk to the young adult directly to see, what they know, to see what their answers are going to be. So that's one of the things that we try to, ask families to start working on, is to see what young adults can start working on to learn about their own health. So that's one of our focuses in our clinic, is working on that. We can go to the next slide. So this is one of our tips that we talk about in clinic, in working on just starting to take over or share ownership over health management. So we encourage families to have your young adult watch you do it. And I will say that young adults are not too enthused about this usually. They are not looking to do it. They don't want it. It's boring. But we try to encourage them to watch your parent or caregiver do it. So, when your parent is calling to make that appointment or doing it on the app, have your young adult watch you, and then you will do it together. So this is where speakerphone gets to be really handy. So, you're together on the speakerphone. Maybe you're doing most of the talking, but maybe your young adult can chime in. They might know their date of birth, or they might know their insurance. And then your young adult can take the lead, but you're still there for support. You're there if they get stuck, or if they freeze, or if it's just like, oh, it's too much, I got to take over, and then gradually the parent can phase out if possible. They might not be able to, but these are things to just start working. And then we talk about medications. So learning those medications names. If someone uses a pill box, our tip is to have the young adult help fill the pill box and also say the name as they're filling the pill box. Or as you're doing it, they're assisting, they're kind of following along with you. And as you're saying the name, every day as they're taking it, it really does become sort of muscle memory. Or when we're talking about remembering to take your medicines, pairing it with another routine. So if you, always, take your phone off the charger, we try to pair things with phones. It seems like everybody's got a phone. So, things that you are doing every day, trying to pair your meds with that routine. We also are talking a lot about smart home technology, or putting reminders on phones. App reminders. We try to, brainstorm things that are no nag systems, because we see a lot of I don't know if you guys have ever experienced this, but like we see a lot of power struggle meds. And we hear about a lot of power struggles where, it gets to be like the parent wants the young adult to take a med, the young adult doesn't want to, and it becomes sort of like an issue. So sometimes there's a system. We've had young adults where they text a little smiley face when they've taken the med, or for people who are more old school, they have a calendar where they do a check mark after they've taken their med. So there's not a conversation where it can get into a back and forth. So I put a link on there for some medication reminders, suggestions as well. So these are some things that we talk about in clinic. Next. So we're not going to talk about this today just because we don't have time, but if your young adult is going to be going to college, and that's a whole other presentation because we talk a lot about college preparation in clinic, but if you want to keep your medication safe in college, you might want to consider getting a safe or a lockbox or something like that, because we have had situations where medications are stolen by roommates, guests, and things like that, and it can be very difficult. So that's just a little tip that we've come up with that you might want to consider, that if your young adult is going to be taking meds and going to college, that can be a way for a safety tip. Next slide, please. So something to consider as your young adult is getting older is, and something we talk about in clinic, is thinking about a waiver and what waiver might suit you if you are transitioning, medically transitioning. So for people with disabilities, so people get very confused about waivers, and this is a very high overview of just because people do get very confused. But for people with disabilities and chronic health conditions, Medicaid can waive their usual rules so that people can receive care in their communities instead of in like an institutional setting. So if you need, let's say, home health care or home modifications or or support with housing or support with jobs, waivers can provide these services that Medicaid isn't typically going to provide. And if you don't sign up for it, you're just not going to get it. So I have a resource on the next slide that talks about the two different waivers that are available that you can choose between, and you can switch if you need to. And just to know that as your young adult is getting to be 18 and then 21 and 22 and transitioning out of school, that these are things that you should be paying attention to and discussing as well. Next. So the big 18, people sometimes are getting very nervous as 18 is getting closer. And this is actually based off of a resource that we give people from Got Transition. And it's called Turning 18, What It Means for Your Health. So this is something that you could print off and talk to your young adult about. And it's about what turning 18 means legally for young adults. And I always ask young adults, like, oh, you're about to turn 18, or, oh, you turned 18. Like, how do you feel any different? And they're usually like, no. But sometimes they'll say, yes, I'm an adult. It is different. And parents get very nervous, understandably, about what that means in terms of continuing to assist with health decisions, of course. And really, the way that I try to explain it to young adults and their families is just that a young adult, when they turn 18, their health information becomes private. And it can't be shared unless they give the okay. So there's things that can be done, and that's why I highlighted this down here. So if a young adult is able to do a consent, it's a great time to fill out HIPAA forms. And it's a great time to do a healthcare power of attorney that lets them say, I need some assistance with managing my health information. It's a great time to think about supported decision making. And it's a great time for families to think about what are the options in terms of supporting decision making. So this is the time to have these conversations. So the doctor is really going to be talking to you, not your parents, about your health. And if you need assistance, it's the time to put these things in place to get that assistance that you need. So this is like a great one pager to just introduce the idea to young adults of what they need to do and what families need to do if they want to continue to get assistance with their health care. Next. So when we talk about decision making in clinic, it can be sort of a big topic. So one of the ways that I try to sort of conceptualize it is to describe decision making as a toolbox. So when you're talking about decision making, guardianship is the biggest tool in the box. It's the saw. Next slide. So when you're thinking about guardianship, I like this quote from the National Guardianship Association. So alternatives to guardianship, including supported decision making, should always be identified and considered whenever possible prior to the commencement of guardianship proceedings. Next. So people are like, well, what are those alternatives? So when we talk about what are the alternatives, those alternatives are supported decision making. And I have all these resources for you because it's just too much to talk about in one sitting. Like this is like such a huge conversation. But guardianship is one option, but also to consider supported decision making, which is legally recognized in Delaware, a healthcare power of attorney or a durable power of attorney, representative payee for SSI or SSDI, special needs trust, HIPAA releases, which we talked about, and surrogate decision making, which are the state laws. So these are alternatives to guardianship that you could consider before making the decision to pursue guardianship, which is the most restrictive alternative for decision making. Next. So I provided some resources on decision making, and I always suggest that people who want to talk about this further consider consulting with CLASSY, which is the Community Legal Aid Society, to talk about different options for decision making, and they can help with different weighing different options and for discussing different alternatives in more time than we have in clinic, because we have 90 minutes in clinic. We have so much to discuss. So here's some information about them, about CLASSY, and then some more information about supported decision making and about the Healthcare Advanced Directive Form, the Healthcare Power of Attorney. And you can kind of look at these at your leisure. Next. So another topic that always comes up is insurance, because we don't want to go without it, of course. And SSI always comes up in clinic as well. So a lot of times people, are pursuing SSI at 18 because the family's resources and income doesn't get considered any longer. So that is something that at 18 people are starting to pursue for the first time a lot of times. And then if you get SSI approved, you automatically are going to get Medicaid, so you don't have to worry about as much of, doing that separately. And then if you have SSI and you have Medicaid, there's special programs for workers too. So, you might be working and also receiving SSI and Medicaid and, being enrolled in one of those programs as well to be able to work in addition to that. Even if you don't get SSI, you might qualify for Medicaid based on your income alone. So insurance is one of those things that we're covering in clinic as well. And just for parents to know that if you have private insurance and your child has a disability, you might be able to keep them on your private insurance as well. You might want to talk to your HR to see if there's a special clause or some, paperwork that you might have to fill out as well, if you wanted to keep them on that. So talk to your HR if you were interested in that as well. So this is a high level overview because there's a lot of different topics to consider, but it's all interrelated. So SSI and SSDI is a big topic. It comes up in clinic all the time. Again, at 18, a lot of times people are pursuing this for the first time. And then sometimes people have SSI already, but at 18, they're being looked at, they're young adults being looked at, reevaluated or redetermined based on their based on being adults. So they're looked at differently based on if their disability is going to impact, if based on their ability to work. So sometimes people aren't realizing that they're going to be looked at through a new lens at 18. So we try to prepare people for that redetermination. So sometimes if you're receiving SSI as a child, you might not necessarily be redetermined and receive it as an adult because you're looked at differently as an adult. I saw a question come through, but I didn't get to, I didn't see it fully. I didn't get to read it.
It says, can you have both Medicaid and private insurance as primary?
Yeah, so a lot of people do have private insurance and Medicaid is a secondary. Medicaid is always going to be a secondary because it's always the payer of last resort. It's always going to be, it would always be a secondary. Go ahead to the next slide. So I make this slide. So every year I do a presentation for Classic, which is the program at the University of Delaware for young adults with intellectual disability who want to have a college experience. And they have a really nice program at the University of Delaware where they get a certificate and they have a college experience. And it's a really nice program. So I do like a whole medical workshop for them. And it's very interactive and they love it. We have so much fun. So I have a slide that I call "What if you don't have insurance?" And they get very invested in like what would they do, like who would they tell? But I think it's a valuable slide because in clinic sometimes I ask people like, "Oh, what's your insurance?" And I love to ask young adults, what's your insurance?" And a lot of times they're just like whiplash because they look straight to their mom or dad like, "Oh my gosh, what is my insurance?" And I've actually asked my own kids that because I have young adults myself, and it's just not something that always comes up. So a lot of times they don't know. So it's a good conversation to ask your young adult, like, "What's your insurance? What's your medical insurance?" A lot of times it just hasn't come up organically. So I ask young adults, "What's your insurance?" And then I ask them like, so if they are covered under private insurance, I ask them if they know how long they're covered until. So once we establish that they're covered until 26 under the Affordable Care Act, I asked them what would happen if they were over 26 and they didn't have their own insurance yet. And they usually don't know the answer to that. So we talked through some options. And with Classic, we spent a lot of time talking about this. So we covered that they should definitely tell their doctor because a lot of times they can connect you with a social worker or a Medicaid advocate who could help evaluate whether you might qualify for Medicaid or the marketplace or something like that. You can definitely contact your state service center. You can go on the Assist website, or we talk about the federally qualified health centers where you don't necessarily need insurance. You can have a sliding scale fee. So we just always impress upon young adults that they never want to go without health care. There's always a way to get covered. There's always some way to get, assistance in some way. You just have to tell somebody. I'm always like, just find a social worker and tell them you don't have insurance. They will help you find it. But that's, my particular bias as a social worker. But we just always want to make sure people know that there's a way to get health care. It's just you have to make sure you tell somebody and know what's available there. So I just wanted to include this slide as one of my workshop slides when I talk to the young adults of Classic. We will make sure we cover this always. Next slide. In talking about independence and taking control of your healthcare, I always talk to young adults about assistive technology and make sure that they know that assistive technology is in their state, and every state has its own assistive technology center. and that there's so many different ways to be independent. And there's so many different ways to, have things that help you be independent. So a lot of times there's things that people don't even think about that can help them be independent, whether they use a wheelchair, or whether they need something that's going to be opening doors for them, or smart home technology. There's so many things these days that can be your hands, that can be your voice, that can, do everything, that can help you be more successful with school. People just need to know where to go to take advantage of this type of technology. So we do spend a lot of time in clinic talking about assistive technology and encouraging people to see what's out there and have a consultation. So every state has its own version of Daddy and Easter seals, and really we encourage people to find that assistive technology and see how you can be more independent. I didn't put it on here, I forgot to, but the centers for independent living are also great places to figure out how to be more independent and have peer support. So we have, the Freedom Center and IRI. And so we always really encourage that as well. Places to find out how other people are doing it and sort of get that inspiration of how people are living with disabilities and special healthcare needs and doing it well. So that's something that we also cover in clinic as well. Next. So this is something that we include in our after visit summary. So these are our top tips for a smooth transition to adult care. And I wanted to include this because I wanted to be able to have you all have these slides. And I think these are really good. These are sort of like all of our years of doing transition. These are like our top tips. So taking charge, and we are really big on self-advocacy. Not waiting until the last minute. So even more now than ever, there tend to be really long wait times for adult care. And I think since COVID, it's just gotten so much worse for whatever reasons. That's a whole other conversation. But so like, for example, to get a primary care appointment, it can take many, many months. So you don't want to wait until the last minute and be like, oh my gosh, I'm almost 21 and I need primary care. Let me just go ahead and make that appointment, because what we don't want is a gap in care. We would rather have an overlap in care than a gap in care, because like for Nemours, the 21st birthday is a really hard cutoff, except for certain circumstances. And yes, we will definitely give you those slides. We definitely don't want you to be in a situation where you don't have a doctor and you don't have someone to write you your prescriptions. We don't want you to wait until the last minute, because that is when we're seeing people really having issues. So what we suggest is to start the process when you turn 20, to definitely be researching who your primary care doctors are going to be, who your specialists are going to be, and to start making those calls then. Because it might take you several months to get in with somebody. And then what if you don't like them? What if you need to switch to somebody else? So it gives you that leeway where you still have your pediatric doctors and your pediatric team, and then you can figure out who your adult team is going to be. And so that would be my biggest takeaway, is not to wait until the last minute, because wait times are significant right now. For the center, it's several months, but like if you were in Pennsylvania trying to get into that FAB center, their wait time is a year. And I can tell you that like for a lot of specialists around, wait times can be almost a year. So don't wait until last minute. Records, here's some tips on sending your records. Knowing your medical history, that's always something that young adults tend to struggle with. So that's some tips on that. We always suggest that people get an ID once at least when they turn 18, young adults get an ID, because otherwise you're going to hit roadblocks with needing an ID. So we suggest, even if you're not a driver, to get a non-driver ID. And then figuring out how young people can carry their stuff with them, whether it's a lanyard, whether it's a wallet, whether it's something you stick on the back of your cell phone. It's good to carry your insurance card, your ID, carry your stuff with you as an adult. And then speaking up, you're the expert on yourself. Just work on those advocacy skills. Making a list of questions for your doctors before the appointment, because a lot of people freeze up in doctor's appointments. So you can help your young adult work on those skills. Come up with like a question or two before the appointment. It will really help empower them to become their own advocate. And again, using HIPAA forms so that your young adult can designate you as their helper, as their, helping them get information, using supported decision making. And then, asking about office policies when you're starting with new providers. And then the last thing on this list is it has taken you your whole life, your young adult's life, to get comfortable with your pediatric team. It's going to take time to get to know your adult team. So just be patient, get to know your new doctors. It's going to be different. That's a given. But it's going to take time to get comfortable with this new team. And just, acknowledge that with your young adult. It's going to take time. It's going to be different. It's going to be hard. It's going to be a transition. Next. So this is my contact information. If you want to talk about any of this, because I did kind of fly through things. Please, you can call me. You can call me and we can discuss your personal situation. You can call, and if your young adult is over 18, I'm happy to chat with you, but I will probably refer you to make an appointment with our team. But I'm happy to talk to you one-on-one as well. So feel free, get in touch. And then I left some room for questions, so we can go to it.
Thank you, Lauren.
Ashley, hello.
All right. Does anybody have any questions? We will get this information out to you guys along with our survey. So if you guys receive that and fill it out, we would really appreciate that.
Okay, I'm going to the other house.
Okay. I have a question.
Sure.
Lauren, could you go into detail about you said Medicaid is always a secondary, or I guess there's always a secondary insurance?
Yes.
I didn't quite understand that because what in your cases, our son is 21. We were paying for affordable health care and it was really expensive. And I just called to find out if we could get some cheaper alternative or like something, different with it. And all of a sudden I started getting an application for Medicaid. And then next thing I know, we didn't even act on it. And he's on Medicaid now. So I canceled the affordable health care.
Oh, so now you have just Medicaid?
Yes, but like I said, we didn't even fill out anything. They just gave it to him. We got all this paperwork and he got a card.
Oh, are you in, I'm guessing you're in Delaware?
Yes.
And do you have an MCO?
I don't
Like
even know.
Health Options or AmeriHealth or?
He has, I think it's First Health or something like that.
First Health?
Yeah,
Okay.
we got it. So I haven't even had a chance to look it over.
And is that his only insurance at this point?
Yes.
Okay. So if that's the only insurance, that's the only insurance. It's just if you had, let's say you had Blue Cross Blue Shield and that was your private insurance, and then you had a Medicaid as well. The Medicaid would always be a secondary because the private insurance is always going to be primary. So if there's two insurances, Medicaid's always going to be the second insurance.
Great. Thank you for clarifying that.
Yeah, but if you only have Medicaid, then that's the only insurance. That's the primary insurance.
Great, thank you.
Right, I don't see any other questions. Thank you so much, Lauren, for coming and talking to us today.